Hi everyone, this is Dr. Morse. Nice to talk to you, and I hope you enjoy hearing my voice. I live in Santa Barbara and it's a sunny day today, but I wanted to take a few minutes to go over some of the concepts that we were reviewing this week and provide you a little bit more information. The first was, it's very important to understand dependent and independent variables. And the best way that I can share to remember this is the IV, or the independent variable, is something that we manipulate. That is the change. That is the experiment. It's what you're doing to affect the dependent variable. So the dependent variable is the outcome. So if you were going to give peanut butter to a group of stat students because you wanted them to do better on a test, the use of peanut butter would be the independent variable, and the dependent variable, outcome variable, would be do better on a test or increase cognitive performance. So I gave you a couple examples there. So the first research question is, will postpartum depression symptoms decrease for women that participate in a support group? So in that instance, the IV is support group, and the DV is postpartum depression symptoms, because that's what you're trying to change as a result of participation in the support group. Similarly, with the next research question, does animal-assisted therapy improve patients' management of stress? So the independent variable is animal-assisted therapy, and we're with that idea, being this would be theoretically driven if you were actually developing the research, would be that this would decrease stress for patients that use that. Cutoff point is also critical to your understanding. That's really going to be important as we move forward into the different inferential statistics. And this is referred to as the level of significance, or alpha. So you got three ways to call it: cutoff, level of significance, or alpha. And that's the point at which the results of statistical analysis is judged to indicate a statistically significant difference between groups. For most biobehavioral research, level of significance is written as alpha equals 0.05. We use the 0.05 because we have a lot of reasons that may affect the results of our studies. We do not have the control of a typical, or a scientific laboratory. There are so many things because we have, for example, psych research or psychobehavioral research. So when we're measuring if animal-assisted therapy decreases stress, well, that would be a hard study to make it have a lot of control, because how do we know it was the animal visiting itself that decreased the patient's stress? It could be that they had just had pain relief. It could be that they had a change in their diagnosis. There's so many behaviors, things. It could be the moon and tides that could be contributing to that outcome, compared to if you had two beakers in a laboratory. You pretty much can control what the outcome is if those two are mixed. So that's why it's usually at a 0.05 compared to hard science. The cutoff point is absolute, meaning so the PI, or principal investigator, makes that cutoff of 0.05. So when they look at their data, anything that's 0.0501 would not be considered statistically significant. But if the result comes back at probability equals 0.04999, that is statistically significant. And as illustrated in the next bullet, if you have a 0.03 and you also had a 0.0049, both of those are statistically significant, with one not being more significant than the other. And a good way for me to remember, and I hope it will help you, is that you're either pregnant or you're not. So that cutoff is specific. You can't say one is more statistically significant or less. It depends on the cutoff that the principal investigator has determined. Then I wanted to talk a little bit about hypothesis testing. And this is where we're leading into. We've been talking about descriptive research or descriptive statistics, and now we're moving into inferential statistics. So with hypothesis testing is done, you can create a hypothesis at higher levels of inquiry. And the hypotheses are stated about the difference between groups, which I asked you to do this week, and about relationships among those variables. We can use a number of statistical techniques, and we're going to go over a lot of these in the coming weeks, such as ANOVA, correlation, and regression. But descriptive statistics are in all research. These are the statistics that you use to describe the sample. These are the measures of central tendency, so make sure you look at the handout that I gave you. This is the mean, the median. We very rarely use the median and the mode, but we use mean and standard deviation. We use graphs. Inferential statistics, on the other hand, allow generalization from the sample to the population. And that's really the basis of many of our statistical tests. We want to see if data support the hypotheses. We do not claim to ever prove a hypothesis is true. So we never say, yes, the hypothesis was proven. Instead, we'll say, because, I'll talk about that in a minute, because one study can never prove anything. This is not law, and that's what law is. Law means that there is no ifs, ands, or buts. It is proven in all instances. With research, it is always possible that some error may have distorted the findings. So under the concept of statistical significance lies the notion of probability. The researcher wants to generalize beyond the sample. He or she needs to know how likely it is that the results are a matter of chance, and statistics are used to tell how likely it is that the observed differences result from chance. And often written as HO for null hypothesis. As the investigator, and that's where I want you to put on your investigator caps in the next several weeks, is you want to think from the null. We don't think from the research hypothesis, we think from the null hypothesis. And this means that there is no difference. It doesn't mean it's the opposite of the research, which is where a lot of people have problems understanding. The null is the basis of the statistical test. If a significant difference is found, you've probably heard this before, the null hypothesis is rejected. And this is where I really want you to think about, is that this is how you as the investigator would think. So you would report if you did find, if your cutoff was 0.05 and you found statistical significance at 0.03, you would say that the null hypothesis was rejected. If you had a score of 0.06 on your probability, you would say that the null hypothesis is accepted, as there was no difference. The last thing I want to talk about is power analysis. A lot of you talked about sample size, and it's really important to understand that power analysis is now an expectation for all investigators to include in when they're looking for funding. And that is related to three elements. And more power is better. Alpha level, effect size, or what the treatment affects, and sample size. And generally speaking, when the alpha level, the effect size, or the sample size increases, power level increases. So we cannot have just a person saying, I want 30 subjects. That was a standard for a long time. We often said 30 subjects per dependent variable. But now we actually have statistical resources and power calculators that will help us to determine what size the sample should be. So I ask you to look at that link that I provided for you and share your thoughts about this presentation. I hope you have enjoyed this, and if I can figure out how to turn this off, I hope you're having a great day, and it's been a pleasure talking to you. Bye now.